So, how are you feeling?
Great. A little tired in the last week, but aside from that, really good.
I'm Ann Partridge, and I am a medical oncologist, and I run the program for young women with breast cancer. When I was early in my faculty position here at Dana-Farber, I began to realize that while all patients have unique issues and stresses, and it's never fun to be a patient at a cancer center, that the youngest patients in our breast oncology group were having the hardest time.
My name is Krista. I'm 32 years old and I have metastatic breast cancer.
I read recently that they might be ending the trial because it's working so well and it's meeting all the standards.
32 is an age where kind of everyone's at a different spot. Once you're in your 50s and 60s, you've generally had a family if you plan to, you're settled in your career, you might think about retiring in your 60s. At 32, it can feel like a roadblock.
So we target and identify all of these young women coming into our clinic, and we reach out to them with our clinical coordinators, and we say, hey, you're a young woman, you're part of the program automatically, here's what we've got for you.
My name's Erin, and I was treated here at Dana-Farber for triple-negative breast cancer, and I'm BRCA positive. The quality of the care that I received at Dana-Farber was nothing I'd ever received before. It was very personal, and I was actually blown away by it because all the doctors are the best doctors in their fields. You know, they just acted like they just cared about me and they wanted to talk to me, and it was very relatable.
And we work really hard to make sure that not only are patients getting what they need medically, but they're getting the right supportive care.
You know, being diagnosed at such a young age, you feel alone, you feel isolated, you feel like no one understands what you're going through. And I think that programs like Dana-Farber's Young and Strong program, at a time when you feel alone, it provides you with hope.
We have our annual forum, which is really kind of the crown jewel in our programming. And the really nice thing about having these in-person programs is that, of course, it's, you know, a good economies of scale. We can get a lot of education in and have a bunch of providers and other supportive care casts from Dana-Farber and from outside come in and educate our patients. But what the patients tell us and what we see and feel is it's also about bringing the community together.
I went before I had my reconstruction, and I met a girl who had the same reconstruction, told me all sorts of information, and made me feel it was going to be fine. And I think that's the most important thing, was meeting other people that have been in your shoes.
You know to call either the research nurses during the day or have me page.
The overarching goal of the Young and Strong program is to help each young woman who walks in our doors to feel like she's taken care of in the best way possible, in a way that she never has any regrets, and she feels better than she would have had she gone anywhere else through the process.